Today, we are joined by Dr. Danica Grujičić, who is one of Serbia's most distinguished neurosurgeons. She has held key clinical positions, most notably as a director of the Institute of Oncology in Belgrade. Her surgical expertise spans brain, spine, and skull-based procedures, and she has led efforts to modernize Serbian neurosurgery to meet global standards. However, in 2022, Dr. Grujičić became the Minister of Health of the Republic of Serbia, a position she uses to champion healthcare modernization, strengthen public health policy, and support young medical professions. Welcome, Ms. Dr. Grujičić. Thank you. Yes, thank you. Grujičić. Grujičić, exactly. Thank you. Thank you. Sorry for that. Yes.
It's okay.
So, as the first question as I have for you is, what initially inspired you to pursue a career in neurosurgery, and why neurosurgery specifically?
Well, I was always interested in space and in the cosmos and in stars and planets as a child. And in the moment that I should join some university, I was in Moscow. I finished high grade school there. And unfortunately, I couldn't get into the Aviation Institute because I was not the citizen of Soviet Union. Back it was 1976. So I decided, I knew that I will get back to Yugoslavia then, and then Serbia, and that I am going to live here. And I decided to get into the medical school because all the exams were recognized by our government here in Serbia. So I have to just pass 3 examinations that are not very important, and to continue after 2 years the education here at the medical school in Belgrade. So why neurosurgery? Because neurosurgery is a space. I always wanted to compare every neural cell as a star, every glial cell as a planet, the black space in and the holes in the spaces were intracerebral ventricles. So I made the comparison between the space and the brain, and still we don't know how the brain really functions. It's a very, very great secret, and that's why I was always interested in secrets. So I decided to be a neurosurgeon very early in my studies of medical school. Even my friends in Moscow in that time, they knew that I would be a neurosurgeon. And thankfully, and thank to God, I succeeded in that. So I was very lucky to work all my life in a field that I was very happy, and I have a job that I liked. That is very important to be successful.
Amazing, thank you. And so you said that you went through from this leaning from space into neurosurgery and how you have connection with that. That connection spark for yourself, or did you have some significant milestones or mentors along the way that shaped you on the path?
I had wonderful professors. First of all, it was Professor Georgievich. He was my mentor for the master degree and the PhD. He taught me that if you want to be a good doctor, not just a neurosurgeon, you have to see your patient 100 times a day. And it is very important, especially in neurosurgery, because in a second you can have burning of the status of the patient. There can be some complications, even if you perform the most beautiful surgery you ever met. So I learned that from him. And according to my microsurgical technique, the best influence had Professor Simovic, Dr. Stanisavljevic. Those are my mentors. Dr. Momir Đorđević, also professor. So I had a really great, a lot of the others, I will not say all of them. The relationship between me and my professors, it was like I've been their kid, their child. So it was wonderful. The expression mobbing, it didn't exist in that time. So I worked a lot because I was a balconies. And in balconies, you have to be twice as good as your male colleagues just to get some patients to get to be operated. But I succeeded, and I really had a wonderful life. I enjoyed my job all the time. And yes, I was very lucky. It is very, very great, especially for you young people, to do the job that you like.
Wow, amazing. Thank you. And exactly, tying exactly what we were saying, having to do twice as hard as your male equivalents. So you were the first woman to head the Department of Surgery and Anesthesiology here in Serbia. So what challenges did you face that with that position, and how did you gain actually respect in your respective departments?
I was very active at the medical school. The moment I became the assistant, we have assistant. It's not assistant professor, but it's just the beginning and educational bit. So I became assistant in the 1992. Then there was war, there was blockades, there were sanctions, etc., etc. And in 1998, I became docent. It's some kind of assistant professor, and the full professor I became in 2005. All the time, I was very active. First of all, at the neurosurgical clinic where I work, I made some programs for the specializations, for the master degrees, etc., etc. And because of that, I was the deputy chief of the Department of Surgery and Anesthesiology of the Full Medical School in Belgrade to Professor Žilomir for almost 12 years. And after that, I've been 6 years the chief of the department. My job, as I saw that in that time, because was to get as much as possible young colleagues into the academic career. It was very important because a lot of my younger colleagues wanted to go to Germany, to United States, to Canada, to Switzerland, etc. And giving them an opportunity to have an academic career was the way to. It was very, very important for me, and I think I did a good job. After me, Professor Alexander Simic is now the chief of the department, and I was for 3 years before my retirement. I was his deputy chief, so I really spent a lot of time and did a great effort in making the programs for students, for academic students, for PhD, for master degree, etc. Yes, I was the first and the only woman chief. It took a lot of time to. My working hours for 40 years were probably 18 hours a day. It was the minimum. Maybe sometimes more, sometimes less. But I started my working day at 6 o'clock probably in the morning and finished probably in midnight.
Yeah. How did you deal with this extreme exhaustion and stress that came out?
I have a lot of energy, and besides, I was interested in everything that was concerning my. It was first of all, I wanted to learn as fast as possible to perform all the complicated neurosurgical operations, etc. Then I realized that I have to follow what's new, not only in neurosurgery but in oncology, because the most of my work can be done in neuro-oncology, in brain tumors and the tumors of the spinal cord. So you have to follow what's new in the medications, in radiation, what are the new possibilities that you prolong the life of the patients, but also that patients have a good quality of life. That is the most important. Until they live, because a lot of them really have a short living period after the diagnosis, especially with glioblastomas, you must give them as long as possible life that you can. So everything was interesting. In the beginning, I was learning. Then I started to perform more and more complicated operations. It was also very interesting. And I started to learn my younger colleagues. It was also interesting. I had to find those kids, those young colleagues who were ready really to work as I did. It doesn't matter. Is it a holiday? Is it a Sunday? Is it a Friday? Is it midnight or it is a noon? On the first place, always has to be the patient. And I think that as a professor, I was very lucky. I had a very good group of younger colleagues who are now performing the most complicated operations.
Amazing, great. And so now that we really kind of got to know a bit more about you and what led you to the path and where you came to be, a main part of this program and everything, the podcast that we're doing, is talking about your positions of leadership, both on your direct structural level as being the head of the department and everything, but also what were some more unexpected times during your work or during a surgery where you need to show this leadership and initiative?
First of all, you have to be very, very good educated, and then you must have authority. So how can you gain authority? You can gain authority because someone will be afraid of you. It's not good. It doesn't last long. Then you can have authority because somebody stands behind you. You have a chief who is protecting you, etc., etc., and that makes you keep quiet even when you are not when you do not agree with your chief. And the third way is, as I had, work a lot, know a lot, be well educated. That is the maybe longest, but the safest way to become a leader. And also, you need to have some kind of thought. You need to have empathy, not only towards the patients, but also for the people who work with you, with younger colleagues, with older colleagues, with the nurses, etc. I told you, I worked a lot, and I obviously had some talent. The best of my performance is the moment that you have some kind of a crisis, that you have to make a decision that will either save life of the patient or you're going to kill them. It seems that I mostly got good decisions. So you have to think fast, you have to react fast, and you have to do the right thing in a second. I had it. The older I became, it was easier because I was experienced, and I tried to send that experience to my younger colleagues. It is very important when you see the mistakes of your older colleagues to learn from them. You don't have to perform all the mistakes yourself. You have to learn from the others. I really tried for 15 years. I prepared my younger colleagues for this moment when I will be retired, so that the patients have confidence to come to them, and I have confidence that they will do the best operation as it will be done all over the world.
So do you maybe recall a moment, because you said this strict, like 1 second thinking, do you recall a moment where compassion guided you more than strict protocol?
Yes, especially when we treated children. You know, sometimes it seems something is inoperable, and you see the small child, mother is crying, the father is crying. You make yourself to try to do something. Fortunately for me and for the kids, in that time, especially it was 90s, we didn't have a lot of MRIs. There were only CT scans. Sometimes something that looked inoperable, really we were able to operate and give the child the chance to, with radiotherapy, with the chemotherapy, get cured. And we had the pretty good results. And then came the MRI and the more sophisticated diagnostics. And yes, I didn't work strictly to the protocol, mostly when the children, the question. And also, you know, protocol is good. You have to keep to the protocol, but if you are keeping strictly to the protocol, you may miss something. So every patient is a case for himself. You have to approach the patient with absolutely new view, as I can say that. Yes, you have the protocol, it's probably glioblastoma, but we shall see. Maybe that patient is not like it seems on the MRI. Especially for the frontal lobes, sometimes you see the tumor that we call butterfly. You think really there is no need to operate this patient because the results will be terrible. And then you talk with the patient, you perform mini-mental scale, and you see that that patient is talking really normally, like you and me. And then you decide to operate, and the operation is successful. So yes, there are protocols. You should keep there, but not absolutely, because in medicine, nothing is 100%. And I think in life, nothing is 100%. You must have your views of living. You have must have your rules, how you behave, but nothing is 100%. So you have to change your behavior, your relationship with the people according to the situation and according to
So, how does innovation really work in your field, and what do you see as innovation, and how do you encourage it in your team?
well, we first I worked in neurosurgery for 40 years. So there was a lot of innovations. I even can't remember the time when I worked on brain tumors without choose ultrasound aspirate. I now cannot imagine how the patient survived my surgery, but they did. And then came an MRI that was a really huge advance in diagnostics. Then, of course, the PET scan, because we deal with a lot of metastatic tumors, and it's very important to decide whether you're going to operate the metastatic tumor or just to irradiate or send it to gamma knife, to X knife or something like that. So then you had a lot of innovations in radiotherapy, especially for the malignant tumors, because when I was a young doctor, all the irradiation was from two fields. Terrible, especially for the midline structures of the brain. And those patients who came to me on the controls, they were psychologically devastated. Fortunately, from the end of the 90s, then was the 3D conformal radiotherapy. It's obviously absolutely a different way. And now you have a much, much smaller number of complications after the radiation. Then for the glioblastoma, we have only the temozolomide. There were a lot of clinical studies for that most malignant tumors of the brain, but unfortunately, till now, we do not have the solution. Germany is working on it, Russia is working on it a lot, United States, Great Britain. We shall see what will happen. I was the generation of neurosurgeons who started to work with from the beginning with microscope. It didn't happen to my older colleagues. And I was used to microscope. Then you have much better microscopes every 5 to 10 years. Then you have monitoring when you follow the motor functions of the hands and the limbs of the patients, because you don't want to make some impairment for them and so that the patients will avoid the neurological death, to be hemiplegic or something like that. And then we started the operations in the lake surgery. So the patient is talking to us, and we doesn't want to make some damage to this part of the brains that are actually responsible for the speech, for the stance, for the recognizing objects, letters, etc. There you also have transcapular surgery and scalpel surgery. It went really fantastic. What now you can do actually on to the nostrils. I'm very proud of this team of my colleagues younger, who my former department. Danica Grujičić is leading the team. Then Alexander Stepanovic and Vuk Stepanovic, they are working together, and I think that they're already the best here in our country, and I also hope that they'll be even better. But they have to publish papers, of course, of their results. The relationship with endocrinologists and with neurologists is excellent. We have really good cooperation with oncologists, with radiation oncologists, with medical oncologists. So, today medicine is a teamwork. Yes, in the center is the surgeon still. But that's why you need wide medical education to understand what's new, where to operate, and when to be more concerned.
Amazing. Thank you. And yeah, I personally have nothing but add.
I must admit that for the last, shall we say, 10 years, everything that is new was done because my other colleagues wanted that. They say, Professor K, we want to do that and that. My job was to just make it possible because I was a professor, I had some kind of authority, I was able to go to the Ministry of Health and ask for some machines. The same was in Institute for Oncology and Radiology, where I was for 3 years. So yeah, it was good, but without young people who are devoted to their profession, who are interested in neurosurgery, in oncology, radiation oncology, you cannot do that. Because when we grow older, I started to think more about the global organization of the health system. But my younger colleague, they wanted to operate, they wanted to be the best surgeons, they wanted all their patients to be without complications, and that's great. That's great. I'm very, very satisfied.
And would you say that this is specifically in your profession, or is it in general that it's usually the younger generations that will quick change?
It should be always. In every profession, we, the older persons, we need to think what will be left when we go to the retirement. If you don't think about that, you are not a true professor. If my colleagues in a few years will not work better than I at my top, then there is no development. And if he wants this development, then it means that every other generation that comes after some generations should be better, work in better conditions, and have better skills.
Amazing, great. Yeah, I have nothing but utmost respect for all medical professionals. And even though this is one of the most physically and mentally demanding professions you can have, I also think it's one of the highest rewarded professions you can have. As saving a life of somebody is a great deal of accomplishment both for yourself and for other people. And yes, go on.
I just want to say, there is a lot of problems with vanity. Yeah. You have every one of us must put the control over our vanity. That's why I insist that today complicated cases are actually it's multidisciplinary. If you do not have good cooperation and good relationship with your colleagues, who will suffer? The patient.
The patient.
And the most important for the doctors and nurses is empathy. Unfortunately, sometimes it seems to me that the nurses have much more empathy for the patients. If you're a doctor, you have an academic career, you need to have papers, you need to have a PhD, you need to follow everything. It takes time, but it doesn't mean that you should forget to talk to the patients, to see them several times a day. Sometimes you go into the room of the difficult patient in a heart condition, and you just smile and say, "Oh, how are we today? What are we doing today?" etc. And they immediately feel better. The patients must know that you care for them. And I think it's in every profession. If you're a client in a bank, I would like to have my banker who take care of me, who wants to save my money, not to spend my money. And if you're a doctor, if you're a teacher, you need to care about you. So I think that with all this new technology, etc., we're becoming more and more alienated from each other. We must educate our children to talk to each other, to play with each other, not just to watch to the iPhones or mobiles or anything else. Yes, computer is a wonderful thing. You can do a lot of things faster, but for example, I just don't want to watch artificial intelligence. What the artificial intelligence has to tell to me? No. I will write down anything that is necessary according to my experience, because I don't know who was the person who put the data into the artificial intelligence. It's very dangerous and it should be put under control.
Yes, thank you. So obviously you took all of your medical and academic skills and transferred them in all parts of your life and also probably later in your career. And so with that thought, that point, I'm curious to what motivated you to transition from medicine to government service. And was there a particular issue or a turning point that propelled you into doing that?
Yes, it was the bad organization of the health system in Serbia. The best health systems are based on general practitioners who are well educated and well equipped. Today, when you have the machines that already have into themselves artificial intelligence in ultrasounds, in X-rays, in ECG, then there is no reason for you to go to the specialists. A lot of things can be done at the level of general practitioner, but that general practitioner cannot have 30 patients a day in 6 or 7 hours. 10. And that general practitioner has the role to health, to perform the health education of the patients and public general, to speak to them, to call them on preventive examinations, and you will then have very successful screenings of all diseases, not just oncological ones. But if you don't have that net of well-equipped ambulatory of general practitioners, then you actually perform all that in the tertiary systems, in the clinical centers, in the hospitals, which is absolutely not necessary, because the patients come to the doctor when they're already jeopardizing their life, because we made, during my ministry, we did the analysis of fulfillment of the hospital beds. And the only 100% fulfilled were intensive care. Everything else, just 50%. So it means the critically ill patients come to the hospital. It's absolutely ridiculous because they can avoid to become a critically ill. Going regularly to their general practitioners, good digitalization, connection with a specialist of some kind that can give some advice to the general practitioner, etc. When I see now what's going on in Europe and what happened in the United States, our funds for healthcare, etc. Yep. Yes, they're behaving like in the United States. There's no different. And we are socialist, maybe not more socialistic, but actually the government gives a lot of money for the health system.
More socialistic, yeah,
Right.
yes.
It's totally regular. That was the main reason that I decided to help my patients. For example, the patient with some kind of operation under control, I have to see an MRI to see the patient. He travels 300 kilometers to Belgrade just to see me, etc. And instead of going to general practitioner, we have a computer. I can ask him whatever I want. I can see the MRI, and I will say everything is okay. X controlling the 1 year. He doesn't need to travel. I have the good relationship with his general practitioner, who can call me whenever he needs, whenever he thinks that he has some a neurosurgical problem or even problem that he cannot tell, but he believes me that I'll find some kind of solution. So the empathy is very important. Hard work is very important. And I really tried to change the system in public health in Serbia. Unfortunately, at the time, I was actually minister for 1.5 years, 6 months with the technical government. I worked actually as a minister 9 months, then 3 months with some quarrels between Minister of Finance and me, etc., etc. But not very important. But the public health system should provide preventive care for the patients, but also when the patients need MRI, he doesn't have to wait 6 months. And that's exactly what was going on in the United States. I saw a lot of interviews of Tucker Carlson, etc. The same problems are there. And it seems to me that some kind of global elite wants just to destroy the public health systems.
Interesting. And obviously, the challenges that you did in government policy are at much higher stakes than everything than what you did as a practitioner. But how does the leadership that you had to show as a minister compare to the leadership that you had to show as a surgeon?
Well, I cannot compare that, because I was the chief of my department and then director of the Institute for Oncology. You work there with the professionals. Treat people, have empathy for the people, and especially in my department, I've chosen the nurses that were working. So my word was really authoritarian. That's why if I say that something should be done, I didn't have to check it out. Unfortunately, I was very, very disappointed when I came to the ministry. And first, I realized that there are a bunch of people who doesn't know anything. Every single nurse at my department knew everything she should know about the patient, his condition, his analysis, blood analysis, urine analysis, temperature, when was he eating, what he has, his physiological needs, every single thing. Then I came to the Ministry of Health, and a bunch of people, 85% of them didn't do anything. They were lazy. They didn't want to work. They were there because of the political. I was not, and I'm not the member of the ruling party SNS in Serbia, and I didn't have the real support from the government. Yes, I have done some things, but with a lot of energy, a lot of fights, etc. But to change the system, health system in Serbia, I couldn't have that. That was no time, but we made a plan. What to do, how to do, where to put the ambulatories, how much to pay the doctors and the nurses. Salaries are ridiculously small in Serbia, ridiculously small, and I'm very angry of that because the work is very, very hard. And you realize that some people who are working near some ministers, near government, etc., get shameless bunch of money for that, for just be there talking, blah blah, and nothing else. And I was very disappointed. And then I realized that if we really want to change anything, not just the health system, but the society, you have to get rid of the 95% of those people who are working in administration right. So I absolutely support Mr. Trump, and I think that the thing that Musk started to do was very well. That is exactly what we have done. We must do that. And besides, my colleagues are young now. Yeah, they're younger than me, but they're 40, 45, 50 years of age, not young and I try as a Ministry of Health, you have to listen to those younger people to see what they want, what kind of machine they need, what kind of microscope, what kind of endoscope, what kind of a laparoscope. They want to perform minimal invasive surgery. It's wonderful, when you don't have a huge scars, etc., etc. And if you don't do that, then you are just lose the connection with the practitioners. It's something that Ministry of Health mustn't allow themselves. So there's a lot of problems. I wanted just to make easier the health care for my patients. That was the only motive I have. Unfortunately, I was very short Ministry of Health, but you never know what will happen in the future.
So would you say that, or actually, let's rephrase the question. What would you say is the most important factor that needs to stand for professionals like you to succeed in their ministry?
You have to be very persistent in what you do, and you have to work according to law. You must. There are some laws that I really don't like, but until they are active, I have to follow them. You have to be very persistent. You have to know what you want, and you mustn't become a Minister of Health in your state. You need to be at least 25 in practice, and then to have some kind of authority. I didn't have the problem with my authority, but the people who were working with, their quality was very questionable.
And would you say for ministries and generally professional practitioners that later go into policy, is it more important for them to have their professional skill inside of their professional field or their policy ability skill?
If you do not have professional skill, you don't know what you want to do. Because if you get some ideas when you work, when you see where are the problems. If you are not in a practice, how can you know where are the problems? So for me, I think that the people who are working will work in Ministry of Health. I'm talking now of the state secretaries, helpers. I don't know how to say that on English. The people who help in some sectors of the Ministry of Health. The Ministry of Health must work at least 25 years in practice, and then to go to the court. Before that, it will be just pure politics, and it's not. You need to have an idea how to transform to better some part of our society, health system, social system too. What was very bad in our government in that time was that ecology was away from the Ministry of Health. I think they should be together because, from the environment, diseases depends, and actually the health of the population depends on ecology. So it should be one minister. Besides, we have the institutions who are already in the Ministry of Health. who are already taking care of our technology. So I don't see any reason why should be that separate. Should be one, but with the professionals who know where are the. If you are not a good practitioner, if you have no experience in practice, how can you be a minister? What will you do? You listen what the president tells you, what the prime minister tells you. Oh, excuse me, the prime minister or president cannot know better than me. Absolutely not. So you need to have the professionals if you want your government to succeed. And I would call all the professionals to come to the government to help to go from the crisis that Serbia is unfortunately right.
If we just move on from what you were just saying, when it comes to this effective and positive change which should come in the government, in the ministries, but will you say that this change will always come from the top down, from the level of minister, everything down, or does the change actually start from the bottom, from the lower levels?
Yes, it is very important. You get the idea from the persons who are working in some kind of profession because they know the problems. I didn't have that problem because I worked for 40 years almost, 39 years when I became Minister of Health in practice. So I really realized I knew exactly where were the problems, and I tried to solve some of them. Of course, in 9 months you can't do anything. We have to change the law about health. We have to change the law about the medications and medical devices. We have to change the law of insurance, etc. It all has to be changed because right now it's a mess, according to me, of course, and according to a lot of my colleagues. On the one hand, you have to be a good professional, an experienced professional to know what to change. On the other hand, you mustn't lose the contact with your colleagues who are working till in practice. Not only the people who are very old, but also with the younger people. I was younger colleagues didn't have problem to come to me and to say, listen, we want that and we want this. And from the other towns also came, especially surgeons, who wanted some laparoscopic machines, some other devices that would make their job easier. And I always try to help. As if I would be just a minister, that you cannot come to talk to me, I wouldn't have that feedback from them. So it's very important for the Minister of Health to have the feedback with his colleagues from younger and from the old ones, and specifically from region to region. Not everywhere are the same. But if you have a good net of general practitioners who can perform ultrasound, X-ray, ECG, defibrillation if it's necessary, reanimation, blood analysis to the patient, then they can finish 85% of everything necessary. But we need to have 10,000 of general practitioners, well equipped, well educated, and very well paid, because they have to be 24 hours disposal to their patient. And then they must be able to talk to me if it's necessary, and I'll say, no, you don't have to transport the patient to me, just give him pads, hear you in a few hours, etc., etc. It would be much easier for the patients, much better. And nurses. Do not forget nurses. They're very, very important. Almost all health systems in the world are kept in alive thanks to nurses. Believe me.
How much do you value dialogue, and especially in this type of environment that you are? What is the meaning of constructive criticism, and how should you take it later on in your work?
I think that the constructive criticism is excellent because nobody knows that, and nobody have insight in everything. So if you are not ready to hear your colleagues, people who you trust, your younger colleagues, older colleagues, and the others who will give you some advice how to do something, how to perform something, how to organize something, then you have problem yourself. What does it mean? Nobody should criticize me. Everybody should criticize, but each criticism should be professional. It should make our system develop and go forward, not back.
And how do you deal with some, for example, less constructive criticism, or also some directly opposite views than yourself?
No, I don't listen to them. I'm very, I do care of the people that I respect, what they think about me, what they would tell me. I listen to their advices. I listen to their criticism. The people who I do not respect, I don't care. They can write whatever they want. They can talk whatever they want. They can imagine whatever they want about me. I simply do not care. As a public person, you hear a lot of comments on TikTok, on YouTube, etc., etc. If you're a public person, you have to realize that there are a lot of people who like you, quote unquote. There is also a lot of people who doesn't like you. They do not like you. They want to comment you, etc. When it's an ugly comment, it's nothing about me. It's about that person who is writing that comment. So I just don't read. I don't care. I know where I spent 40 years of my life. I know what I did, how many people I helped. Fortunately, a lot of patients that couldn't help, the disease that couldn't be treated, etc., etc. I know what I did to my students, to my younger colleagues, to young neurosurgeons, to young oncologists. I think in my 40 years of professional job, I've done a lot of good things. And I simply do not care what they think and what they write down. If it's something, someone who I do respect because of his or her professionalism, then I'd like to talk. And if it's not, I simply don't care.
Right. Yeah. So going from there, you in the past met with the medical graduates to inspire them. And what piece of advice did you give them with everything your work and your career and the knowledge that you have? And what is generally the advice you give to people who are aspiring leadership, both in medicine and outside of it?
They have to know a lot. They have to work a lot. They must have good results. That is the only way that you can have authority that you need to be a leader. And you must have an empathy. First of all, toward the patients, because we are here for the patients, not because of ourselves. And then also to your younger colleagues, older colleagues, and nurses. For everyone that you're in contact, young doctors at all, they're working with people. You need to have empathy for them. If you do not have empathy, change the profession. You are not suitable to be a doctor.
Looking back, is there a path you wish you had explored or choices that you wish to have made differently as a leader?
Maybe some small things, but nothing crucial for my life and for my professional work. I think I probably wouldn't change 99% of my life. I enjoyed every day because I loved my job. I told you at the beginning, I was very lucky. I worked for 40 years in a field that I loved, that was interesting to me, that challenged me every day from day to day. And it's really, I just must have thank God that I had this opportunity.
Great. And what skills and qualities actually do you think will be most important for the next generation of medical or public leaders?
Empathy for the patients. That's the most important thing. Then they have to follow what is new in medical. They have to follow protocols, but never to forget that there's nothing 100% in medicine. That they need to approach to every single patient like they're examining him for the first time. That's the most important thing. Because if you look straight into the protocols, then robot can do that, right? You don't have to be a doctor. The fine word, the feeling that the patient must feel that you care for him, that you want to make his life better. That's the most important thing. If you don't have that in yourself, if you are not educated to show at least that, then you will never be able to. And everything else you can learn. Surgical skills, oncological skills, everything else. It can be learned. But that connection with the patient, connection with the human being, empathy for all the people you're working with, and especially for the patients and children, that's, in my opinion, most important.
And later on, what do you want your legacy to be, or what do you want to be remembered about? More as a professional surgeon or a professional in policy of health in Serbia?
Absolutely professional surgeon. My legacy should be my younger colleagues.
Your ones.
I can freely call them my school in Podgorica also, in Kragujevac also. So I'm very proud of them. They're really good neurosurgeons. They're very empathetic towards the patients, and they really do a great job.
And you probably also...
It's my legacy. I hope that they will do the same with the younger.
Exactly, that's what I just wanted to say. Probably also what wants them to do the same thing with their younger colleagues. Exactly.
I believe they will. I believe
Yeah.
they will.
And what do you carry from your patients that you still carry? Sorry, what did you hear from your patients that you still carry with you every day?
Well, now I don't work anymore. I'm not in a
Yes.
private practice because neurosurgery is too complicated to work in a private practice, at least in Serbia, maybe in some other countries. But here in Serbia, we really made a great team at the clinic for neurosurgery and Clinical Centre of Serbia. And I just can't imagine me working without them. It's together you have to work with them. So yes, I can be the leader of the team, but I'm just one part of it. If you don't have a good team, it's teamwork, today's medicine. If you do not realize that, then you have a good in your mind. So teamwork is very important thing. I was very lucky because I was able to choose. Sometimes you're not able to choose the team that I went. It's a privilege. I had it, and that's why we were so successful. We made a center for neuro-oncology, daily hospital for our patients, gamma knife, fixed knife, everything really that we can, all the machines that we need to help the people. Now come new machines, new techniques in surgery, in oncology, etc. And it's the job and the problem of my other colleagues now to fight for these new techniques that will allow them to work better than I did. And right now I have only consultations. There are patients, some of my old, some new. They send me by mail their MRIs, and we just talk what kind of complaints they have, what is logical status, etc. So usually, if it is a neurosurgical case, then I call my other colleagues from my own department and ask them to operate.
Earlier in your life, when you were still practicing, actually, when you just got out of medical school, and today, who are you outside of your professional environment? Who are you when you're not at work or not thinking about your professional environment?
I'm a person with a lot of friends, lots of family. Our family connections here in Serbia are very, very strong. So I have a lot of family. I have a lot of friends, real friends. My friendships last for more than 50 years. So I spend them with them, and I think I'm a good person who I like to help. It's just it became a part of me.
And through life, did you keep your career and your personal life separate, or was it interconnected for you?
Well, my professional life was my life. I don't have a family. I'm not married. I don't have kids, but I have my nephews. I have my nieces. I have the children of my very, very good friends who I know from the moment they were born. I enjoy their success. I enjoy everything they do. My best friends now have grandsons and granddaughters, and I also enjoy those kids. So my profession was my life, and I wouldn't change it.
Amazing, great. And just to wrap up, what aspirations would you recommend young people today should pursue?
No matter how professional they are, they need to have some time to spend on social activities. They need to have. I realized that pretty late because neurosurgery was difficult, and then was 90s when I remember how we worked without anything, without medications, etc. I just don't know how the patients survive. So my generation, we passed a lot of things. 90s, then 2000s, then this what they need to have more involved in institutions who are making decisions, syndicates, professional organizations, and also to be politically educated, at least a little bit. My colleagues, they really have some opinion about everything that is going on in Serbia, not just now, but years, for the last 30 years. It is important to be active, not just to sit. I started my activity in 2012. I was even the presidential candidate. And I started to be more and more active. Internet gave me an opportunity. I started in 2016 to make some blogs about the problems in our society. I think that's, I never spoke about my private life on internet, but about the problems that we are seeing every day in our life, about systemic, I think it is the obligation of every intellectual to just say its point of view. If you criticize something, it doesn't mean that you have to insult anyone. I never say names. I never say the names of the companies, etc., because there are a lot of things I don't know, but I can see if they're doing something bad. I'm talking about some things in our society that are not good. And I think that's our goal. It should be our goal. So yes, you have to be great neurosurgeons, great professionals, great oncologists, but also you mustn't say I'm not interested in politics. You have to be, because unfortunately, as we can see now in the West, in democratic West, etc.,
Yes. Thank you very much. Great. This was very inspiring, and absolutely I agree with you on a lot of points, especially that you feel like, especially if you're contributing on some level in your field, you should expand that, especially if you're a professional in that field. It's your obligation really to like improve your system and your field. Exactly.
Well, you defined it well.
Great. Thank you. Thank you really for your time. Thank you for your interest. It was really great discussion. Exactly. Thank you.
I like to talk to young people because you make me younger.
But yeah, that's the point, that you really transform your knowledge and everything onto younger generations so that there's something really taken what you get from that and just improved on it.
I think I did it, especially in neurosurgery.
Amazing.